Hi Sharon, my name is Dally. I'm going to be your nurse today. I'm just here to do a quick assessment on you after you had your baby. And can I have you tell me your name and your date of birth? Okay, perfect. That matches what we have. So I'm just going to start by getting a set of vital signs on you. And then I'll do the full body assessment and just ask you a few questions. Do you have any questions before we start? Okay, sounds great. So I'm going to start by doing some hand hygiene. And then I'm going to put on some gloves. And I shut the door so that you have privacy while I do this. Is your husband around? Oh, he just went home for a minute. Okay, but he's doing okay, supporting you in the ways that you need. Great. Okay, so I'm just gonna get your temperature. 37.2, that's within normal range. I'm gonna slide this on your finger so you can check your pulse and your oxygen. And while that's checking, I'm going to get your blood pressure. Looks like it is 122/78, which is great for after birth. And your oxygen is at 96%, and your pulse is at 82. So that is also great within range. I'm just gonna listen to your heart and your lungs real quick. Okay, and then just take some deep breaths for me every time I move this. And I check the back as well. Great, everything sounds clear. I'm just going to check your breast to make sure that you're not engorged or any abnormal redness or swelling. Has the baby been able to nurse okay? Latched on okay? There's no extreme pain or anything? Okay, everything feels fine. And just call the next time you breastfeed so that I can just make sure the baby's latching on okay. Alright, I'm going to move this blanket down. I'm just going to check your belly and then your bleeding. And it looks like your IV is intact and clean. So that's great. Is it causing you any pain or anything? Perfect. I'm going to lift this down and I'm just going to feel your fundus to make sure it is contracting the way it should be. So it should be firm and at or below the umbilicus, which it is, and it feels great. And I don't feel your bladder. Have you been able to use the bathroom? You feel like you're emptying it all the way when you go? Oh, perfect. If you need any help with that, just let me know, or my aide. And then your bleeding looks great. There was nothing, no clots or anything that came out when I pushed on your fundus. So I'm just going to check for Rita, for the redness, edema, ecchymosis, the drainage, and the approximation. Everything looks great. So I'm going to look at the bottom, and it looks like she's swollen and red, but nothing out of the ordinary. While I'm here, I'm just going to listen to your stomach. Have you been able to have a bowel movement? No, not yet. Have you been able to pass gas? Oh, great. Let me just listen. Okay, everything sounds great. You're covered up. And then I'm just going to check your legs for any abnormal swelling and some blood clots. And then also your reflexes. So I'm going to bend your knee. That looks great. Perfect. Then just rotate your ankles. There's no pain or anything with that. Great. It looks like your swelling's gone down a little bit, so that is good. Do you feel like you're able to get up and move on your own, or do you need some additional help? I know it's your third baby. Oh, okay. If you need help, just push your call light and we'll be in to help you. Are there any cultural or spiritual help that we can do for you? Anything that we need to do different? Okay, just let us know if there is. When you go to the bathroom, just make sure that you call us if you need help, and if you have any clots that are bigger than the normal size, just let us know so we can come in and weigh the pads and make sure that you're not at risk for any abnormal bleeding. I know that you've had a baby before, a couple of them, but I'm just going to go over the postpartum kit to make sure you understand all this. So you've got your peri spray. You can use warm water and just spray down there when you go to the bathroom to help clean it and soothe. And we've got your touch pads you can put in your pad to help with the discomfort and everything. We've got your underwear in here, and there's more in the bathroom that you can use. And then we also have your dermaplast spray that will help cool and kind of numb that area while you heal. And then just a few other things like for your hemorrhoids and stuff. If you have questions about anything, just let one of us know. How is your pain right now? What would you rate it? Just a 3? Okay, that's good. If you have anything change, you need more pain medication or anything, just again, get on your call light and let us know. So if you had any extreme pain or anything, do the Caldera, so the characteristics, onset, location, duration, exacerbation, relief, radiation, and associated signs and symptoms. Okay, I think I'm good with you with your assessment right now. If you have any other questions or anything, just let me know. Your baby's so cute. Looks like you were doing well holding her. Everything looks good.